We will now move forward on the proceedings. The following keynote panel discussion is on the newly formed Rural Health Alliance Aotearoa New Zealand, RHANZ, and features 4 key speakers. Can I invite them to make their way up onto the stage? Dr. Joe Scott-Jones, Mike Ward, Professor Lesley Barclay, and Malcolm Alexander. RHANZ is a collaborative, community-focused organisation that will provide a cohesive, unified voice about the health and well-being of rural communities. 5 founding member groups are involved in the initiative, and an interim steering group has been operating since March 2012. The 5 founding members are the New Zealand Institute for Rural Health, Rural Canterbury PHO, Mobile Surgical Services, the New Zealand Rural General Practice Network, and the New Zealand Rural Hospital Network. Dr. Joe Scott-Jones has been the GP Principal in Opotiki since 1992, well known to all of us obviously, and currently the chair of our New Zealand Rural General Practice Network. Mike Ward has been the independent chair of RHANZ and is currently the chair of the PHO Alliance, chair of Wanganui Regional PHO, governor of Gonville Health, and manager of Whanganui Community Living Trust. Professor Lesley Barclay is an educational leader, health services researcher and systems reformer whose projects have improved maternal child health services in urban and remote Australia and internationally. Her current position is Professor and Director of the Centre of Rural Health at Northern Coast for Sydney University. Malcolm Alexander is the Chief Executive of Local Government New Zealand, which represents the national interests of councils in New Zealand. May I present the panel?
To Mihi, that wonderful, inspiring message, a simple message, but one that we all need to remind ourselves of. That was wonderful, thank you. Just to touch on RHANZ. Rural Health Alliance Aotearoa New Zealand. Good morning, I'm Mike Ward, and I've just had a small role in the formation of this organisation. I think it's particularly important in a very short time. I'll give you a reason why. So what is RHANZ? Very, very briefly, it is an organisation of organisations. It is a unified voice for cohesive social and population health for rural New Zealand. By rural, I mean any region not defined as main urban by New Zealand statistics. By health, I mean the process of engaging social, mental, spiritual and physical well-being. I believe, and we believe, that health is a fundamental resource to the individual, to the community and to society, and that even more so, health is a basic human right. I won't try and sell you these details, I'm just going to make some brief points. We believe the health and well-being of rural communities is under threat. Obviously, there are workforce issues, there are funding decisions, there are one-size-fits-all policy-making analysis. Why do we all accept that rural populations have less access to health services than the rest of New Zealand? So I think that needs to be challenged. I don't believe that is fair or just. If you read the United Nations Declaration of Human Rights, for example, it's an old document now, but a good one. Fairness and access come in an awful lot into their language. Why does not dialogue about health start from the basis that all of New Zealand's needs easy access to primary healthcare options or any kind of healthcare options? Part of the reason I get so passionate about this, just as an aside, is in my latter career, ever since I moved over from the dark side of corporate business into the dark side of community-based, not-for-profit disability sector organisations, where I make my day job living and advocate. I've always wondered that why is it that disability issues are so important? Now just bear with me a second. It's because if we get things right for marginalised populations, in this case, people with disabilities. If we get things right for that population, guess what happens? They become right for everybody. They become a litmus test, a canary in the mine, if you will. That's why I'm so passionate about rural populations and rural health. You could argue that Wanganui is not much of a rural centre. Well, I would argue that we would have a debate about that. The Wanganui district covers a great deal of New Zealand's hinterland and the interior there. And these problems are things I face every day. How come we can't get equitable access to health services? How come there's an unspoken or a tacit acceptance that if you live an hour and a half away from a town, therefore, well, of course you're just going to suck it up. Of course you're not going to complain. Of course you're not going to travel. Of course you're going to keep on keeping on. Of course your mental health and stress will be affected. I'm saying it's more about fairness. RHANZ wants to develop three things: a strong presence in the advisory and policy development fields, obviously. Close working relationships, networks. We've had some fantastic speakers over the past days about networks, some of the wonderful things that are going on, some of the ground up driven initiatives. Wouldn't it be great if they all could actually come together? So a single point or a conduit which would strengthen the activities of all the organisations involved. We've got some champions on the panel here, and you'll hear from them in just a second. But I want you to pay particular attention to Lesley, who's going to talk about the Australian experience, from which we lifted and plagiarised an awful lot of structural and definition. Fantastic stuff. So why is this so important? Because not doing anything is not an answer. Do we really think that government and government policy setting, for all the fact that they're very, very clever people, far cleverer than I, are actually going to come up with answers that one size fits every situation? I think that's unlikely. To take a point that Henare made, the answer is in looking at us in the mirror. We have some fantastic strengths, we have some fantastic capacity and competence. All it needs is a wee bit of direction. It's not about control, it's not about master-servant stuff, it's just about, wouldn't it be great if we all got together on this? Then, instead of being a crumb from the table, rural health would be at the table, determining and having a voice of influence and outcome. And you'll hear some wonderful examples of that very shortly. So that's just a wee bit about who the heck is RHANZ. I'm quite proud to have had a small part in the formation of that organisation, but in fact the heavy lifting is done by the operational people and by the supporters and funders. So thank you for that. There'll be a chance later on to take some comments from the floor, and I'll just hand over to Joe Scott-Jones. Thank you.
Thank you. So I think I should have a presentation to show. Whoops, there we go. So the New Zealand Rural General Practice Network and RHANZ. Why, basically? We know, I mean, you know, everybody, we all know this. There's been an urbanisation of New Zealand's population, but there are a lot more children in rural New Zealand. We are an older population, older Māori population, higher deprivation, and there are lower levels of employment in rural areas. We know all of this. We deal with this every day. We know that there are worse outcomes for cancer in rural communities in New Zealand, that rural Māori have a lower life expectancy than urban Māori. We know that there are high rates of injury, poisoning, and spinal disorders. We know that there are high rates of female current smokers, that people living in rural areas are less likely to have seen a general practitioner in the last year. We know that they're less likely to have had a test or a vaccination or be diagnosed with a chronic disease. That might be because they're better than people living in urban areas, but they do use public hospitals a lot more than people living in urban areas. And there is a higher risk of male suicide in rural areas. We know all of this. We live with this every day. These are the people that we're dealing with. These are the issues that we're dealing with. Of course, there's a higher rate of animal and poor water-associated diseases in rural communities. We also know that the number of people living in New Zealand is growing, but the proportion of people living in rural New Zealand is falling. And that affects the way that central government sees the power of the rural vote. Those of you sitting in the room, we're all very familiar with the fact that there's a crisis in rural workforce. We have figures around general practice and general practitioners, and we can take these as a proxy for the issues with midwives, with nurses, with pharmacists. Currently, 25% of general practices that the Royal General Practice Network knows about have one or more permanent vacancies. We know that 57% of rural GPs are international medical graduates like myself. The issue there is that international medical graduates tend to fade away as time goes by. They tend to return home. We know the average age of the rural GP is between 50 and 55. I've just joined that average group. So that means that there are 14 practices currently identified that we know about where their GP is within retirement age, that are around 65. I think this represents a crisis. We know about this. This map represents where some of those crisis points are around New Zealand, and they're scattered. The reason why people leave general practice, this is from very recent review of the information that we have. I think it's quite heartening to see the majority of people, 34% of people are leaving because they're not shifting out of the country, they're actually relocating within New Zealand. About 20% of vacancies that we know about are there because practices are actually growing. They're amalgamating, they're increasing in size, they're wanting more GPs, but they're finding it very difficult to fill those places. Only 5 of these are to do with overseas locums returning home, but we know that there's a workforce crisis. The question is really, what can we do about it? And where does RHANZ fit in? RHANZ fits in with the desire to be near family and friends, being able to link practices with their communities and provide people with the friends, with the linkages into the society. RHANZ helps with the ability for us to train people in rural communities, because the communities can help welcome in students, can help welcome in trainees, and make them feel embedded and focused into their communities. RHANZ can help with the privacy issues that address us by communicating the message that being shown the inner aspect of somebody's thigh in front of the Cocoa Pops in the supermarket because they think they've got a black mole there isn't necessarily, doesn't make the doctor feel particularly comfortable. So RHANZ can also help us to support that workforce agenda centrally. It can provide us with practical issues around recruitment and retention. It can explain our issues to their members. It can be a conductor and an enabler of research in health. It can provide a huge network of access into community points where we can access the people where they are when we want to find out about health and well-being. When Dairy New Zealand or Rural Women come and do a study in your area, or they're promoting some aspect of health in your area, currently they may bring in their external experts to do that. They may not actually connect with you as the local team. Hopefully they do, but we can make sure that that happens. And they can also help us to identify the future rural providers, the future rural pharmacists, nurses, occupational therapists, doctors that are out there, and help us to mentor them and help us to set up a structure where we can actually start their career pathway at high school. But there's more. We had our RHANZ Day the other day and had this presentation from Federated Farmers. Lesley, Federated Farmers came. These years, when there's a peak in rural suicide, meet with times of drought, times of a high New Zealand dollar, times when the lamb and beef prices fall. I didn't know that. How does a farmer see the world? I know farmers. I have a friend who I sit with once every 2 or 3 months and chew over the fat of the way our business is running, and he tells me about the farm workers and I tell him about the surgery staff. Not all farmers are the same, but this comes from Federated Farmers. This is what they say how farmers behave. I won't read it. This is how farmers see themselves. I didn't know that. Federated Farmers in January launched their wallet cards, key access points to encourage farmers to access health services because of this increased rate of suicide in rural communities. I didn't know that. This is about what matters to you medicine. The RHANZ is about giving us the opportunity to understand what matters to our communities. That for the Federated Farmers, mental health outcomes in a year of drought, the high New Zealand dollar for us and for our kids. The loss of the rural post delivery, one of the few social contacts that happen for farmers. And rural broadband? Yeah, right. You know, the only way I can actually communicate with people is through the post because I've got dial-up, mate. Very poignantly, the reduction in bus subsidies for school bus services. I didn't know this. They're now less frequently. There are more kids on every bus. This is an accident waiting to happen, and Federated Farmers are really worried about it. There was a bus crash just outside of Taniatua. A logging truck went into the back of a school bus last year. I was quite upset. Gosh, I didn't realise how upset. I was quite upset that the proper emergency services, the prime people in particular, weren't called out to that. We've got an opportunity, a great training opportunity here to go and demonstrate with our students, take a prime course out to Ruapehu and do a mock-up of a bus accident and just show the government what it means when you reduce the bus subsidies, but also take the opportunity of getting a fantastic training opportunity for ourselves. RHANZ can help us to keep the rural on the agenda. It can identify what matters to you, medicine issues. It can be a common voice when sometimes a common voice is stronger than lots of voices. And well, I don't know whether it will develop a rural health strategy for New Zealand. We've only just set up our very first. We have an interim executive. We now have a full executive, and we need to decide our strategic plan. But I think this is going to be a key document that we'll need to develop. My message to you today, if you've got half a brain, then get your rural organisation to join RHANZ because it just makes sense. Thank you very much.
Good morning, everyone. My name is Malcolm Alexander. I'm the Chief Executive of Local Government New Zealand. I was going to start this presentation by saying, I suppose you're wondering what local government's got to do here, but I just listened to that presentation from Councillor O'Keefe, and if that gentleman doesn't epitomise what the power of a local person in their communities to make a substantive difference and change, I don't know who does. That's why I do this job, for people like him. Local Government New Zealand is made up of and represents all of New Zealand councils. It ranges from Auckland Council, which we all know, out to the Chatham Islands, which I went and visited for the first time in January. In the policy debate that goes on out of Wellington and around, there's a lot of focus these days on the development and growth of Auckland, and certainly LGNZ believes that's as it should be, because Auckland will be New Zealand's metropolis, and we've got to understand and work with that. But the rural and provincial sector of New Zealand remains the economic heartland of New Zealand. Mayor Liam Brown often quotes, quite correctly, that Auckland's about 32% of GDP in New Zealand, and that's true, but about 26% is consumption. Actually, the GDP and the wealth of this country is generated in the rural sector of New Zealand, and is likely to be the case for many years to come. But it is also the sector, leading on from what has just been said, where it is the sector facing the most significant demographic challenges going forward. Yesterday, I was at what we call the Zone 2 meeting. This is the meeting of the mayors and the elected members of the Waikato and Bay of Plenty through over to Rotorua, down over to Opotiki. And we had a presentation from Professor Natalie Jackson of Waikato University, Professor of Demographics over there. And what she had to say was quite eye-watering, to be absolutely frank with you, very sobering. Together with the rest of the Western world, and in that context, New Zealand is actually quite a young country. So this is already happening in Europe and the Americas, etc. But even here it will happen. New Zealand stands on the brink of major social change. Within the next 20 years, and it has already started, but within the next 20 years, most territorial authorities in New Zealand will start to depopulate. And by that we mean that deaths and outward migration will soon exceed births and inward migration across the country, with the exception of the major cities. This has major ramifications for policy now it's hardly known about. We're having Natalie speak at our local government conference in July in Hamilton to present her findings, but these are pretty profound. For example, if you are going down a policy line that looks to centralise activity, to get cost savings, etc., you're actually accentuating that depopulation. We had yesterday an announcement in the Waikato that the police are going to centralise their community constables in Hamilton. So, for example, if you have an issue in Matamata, a good 45 minutes drive and they'll sort it out for you. Actually, Natalie's proposition is the very last thing you should be doing is centralising the police force in Hamilton. You should be maintaining the community force in rural centres like Matamata to create and enhance that vibrant nature of those communities. Doing the other is exactly the wrong policy response, but it is made for the dollar reason, not the social and community reason. So in these times, the key focus of local government New Zealand is going to be, looking forward, will be for us to how can we work with partners to foster the ability of rural and provincial communities to meet their needs as this depopulation trend grows over the next 20 years. For us, healthcare is top of that list for obvious reasons. So we are committed to advocating our elected members, from President Lawrence Yuill, who coincidentally is Mayor of Hastings District Council, where Councillor O'Keefe was from, will be focusing on how to help and support the communities in these areas so that they can contribute and continue to contribute to New Zealand, remembering without them, this country's wealth is in peril. The people I represent are the communities of New Zealand. It's about local democracy. It's about the ability of communities to choose and shape their lives and how they wish to develop. We've got a new vision at Local Government New Zealand. I would show it to you today, but I've got to show it to the members first. But we're launching it on 1 April. It's this: local democracy powering community and national success. It is our strong view that you have a strong nation when you have strong communities first. And that's where we'll be putting our effort, and so we're happy to help and assist the Alliance and their activities as they go forward. Cheers.
This is an extraordinary privilege, and I have to say it's very seldom I'm moved to tears in a conference. This morning I was moved to tears on multiple occasions, and tears that reflected my emotional response but also my huge respect. And I have been very privileged to be part of deliberations since Wednesday with an incredible group of people, and I've loved every minute of it. But this morning was a gift that very, very seldom one has in a lifetime, and I'm very privileged to have been part of it. Okay, I've got some slides and I'm going to try and just put them up and talk to one or two things, but there's some insights that we've learned from 20 years now of doing exactly what you're trying to do now. Not trying, you've actually started, you've had your annual general meeting and you're on the way. So, oh God, I've got to do this. Right, there we are. Okay, so again, very similar. Began with rural doctors, and government, rural doctors went and tried to get some money to fund a national conference, and were told, no, we won't fund a doctors' conference, we'll fund a national conference around health. So that's where we started, and the quote on the bottom is the important one, because that quote has actually become a mantra for us. That was the Minister for Health at the time, who was being lobbied by medicine and by rural doctors to get something up for rural, and he said, don't bring me your different views, bring me what you agree on. And so our mantra has been, bring what we agree on, but also bring solutions. And that has actually led us really well. Not the deficits, not the problems, not the difficulties, not the challenges, but how we can do something about it, because we've got some solutions, because we actually understand what's happening. This is how we work, and your council is working very similarly. Plagiarism is not the word, sharing is the word, and one of the things that has been really great is to see that some of the stuff that we've battled and learned over a long period of time, you've been able to accelerate because we've been sharing. But this is how we work, with a council of 33 bodies that are members of the organisation. About 5 of those are consumer-driven organisations, Country Women's Organisation, those sorts of people. And we have a board that's elected from the council, we have a CEO, and we have a secretariat that supports the board, and we have an organisation called Friends, and they're people who just are committed. They're not a council body, they are part of the council representing Friends, but those are people who just believe in rural health and want to join us. So this is how we work, and the two things that are really important here, and this is the effectiveness of what we're doing, is working with government and working with the Australian public. So we have a very strong voice directly to the Minister, and this is one of the things that we've been discussing since Wednesday. If RHANZ becomes a powerful voice for rural, the Minister is going to be very grateful to have an avenue to finding out what's going on, because this protects the Minister from making silly statements or getting into strife, because you will inform the Minister, assist the Minister to develop decent policies. Now, we do that at the same time as the Minister in opposition. So we will go and talk to the Minister, but then we'll go and talk to the Shadow Minister and make sure they have the same information. So we're apolitical in the way we work across political parties, but we're intensely political in strategising what matters in relation to rural health. So it's not just at the level of the politicians. The other effectiveness of the organisation is working with the senior bureaucrats, who again know that if they want something to get through, or if they want to be informed about something where they're making policy, they come to us. because with our 33 member bodies, from consumers through doctors, allied health, nurses, everyone you can think of who's expert in the field will have some answers for them. We've got health administrators who run small hospitals. We've got all of those people around the table in council. So if we've got a senior bureaucrat who's under pressure to do something about rural, they come to us and we can help shape the answers. If Parliament has an inquiry, for example, into locum services or fly-in, fly-out services, we put in a submission. Our submission is a key element of the policy that comes out from government. Now, the other way we work is with the Australian public. We have a very high media commentary, standing with the media. We tweet, we do all that stuff, which I'm not very good at doing, but we do lots of press releases, and the press releases are very well constructed and they're often picked up. You know, we could be doing 20 or 30 interviews after a press release that go around the country. Many rural radio stations pick up on those press releases. It's a really good way of getting that information out there, but quite often it's national press that will pick up on that. We're very careful about how we manage that, and it's only myself or the CEO who takes those press releases or the commentary, unless we have an expert on the council who's the right person, and then that person gets delegated. So no one else talks on behalf of the organisation because it's, we have to be extremely careful about how we do it. But we manage that very well. Okay, I'm just going to put these up. And they are probably really important to talk to. As you can see, what we share is a passion about rural and remote, and the people in rural and remote who don't get the health services that they deserve. So that's what holds us together. It's that shared commitment that's bigger than our own organisations, which is the larger common good, which is a rural and remote population, and the aspects of that population that are missing out on services. Full-time, skilled CEO, Gordon Gregory, who some of you know, has done the most amazing job. Really very important that there's a go-to person for government, and that is not the chair. I'm the chair. I'm not the person necessarily who they go to. It's Gordon in the office. If Gordon wants me to be part of something, we do it together. But that's where that full-time person's available. Evidence. Now, one of the things that we've done recently as an organisation is sponsor the Australian Institute of Health and Welfare to look at the inequities in spending. Now, there was no evidence that said that there's an underspend in rural and remote health. But Australian Institute of Health and Welfare did the most wonderful paper. We put some money in there. They did the paper, and that shows there's a $2 billion underspend to rural and remote Australians as a result of their analysis. Now, that gives us a hugely powerful weapon in our political argument for better health systems and better health services for rural populations. The other thing that's really important is that we ensure consensus. We're driven by consensus of our member bodies. So if there's a particular issue where we're not going to get consensus, it doesn't go any further. And there are some issues that go to the council and we see if we can get consensus. If we can't, we pull back from that. We're not going to damage the organisation by getting into confrontation. We can't afford to do that. So there's a high level of respect and dignity that there are some things that we won't have a shared position on. One of those in the last few years, for example, has been nurse practitioners, with some GPs and GP bodies having very strong feelings about it, and the Nurses Association and their rural chapter, who's part of our organisation, having very different strong feelings. So that's been off the agenda. Political positioning and support. And you can see how we are apolitical, but we not only visit the ministers. Once a year we have something called Council Fest, and you've probably heard Jenny and Gordon talk about Council Fest, but it means we have our meetings in Canberra. Everybody gives up 5 days of their working life, including a weekend, to work together to re-evaluate our strategic plan, to be really clear about what our priority is, to establish those, to establish our council and our board, we have those elections. Then we spend a whole day in Parliament House in our T-shirts, bright green T-shirts, and we visit 20 to 30 members of Parliament, including the Minister and the opposition Minister in waiting. And we sit in Parliament in our T-shirts feeling very obvious. It's not the sort of thing I would prefer to do. But, of course, everybody recognises rural and remote. You know, they can't escape us. And no one tries to cancel those appointments. They're really important appointments. So we meet across all parties and we go in small groups with our agenda in front of us and we brief people. The other thing is that we make competitors into allies. We work together. And again, very much reflects the quality and skills of the CEO, really important role, but also council members. Okay, so membership becomes sought. It's something that people want to belong to. There's certain hoops getting into that, so we have large professional organisations, but we don't accept them unless there's an active rural chapter. There has to be people, for example, within the GPs group who are a rural chapter of that group, or the Australian Nursing Federation, we have a rural chapter. So it's not a large organisation per se, it's the people from that large organisation who are working rural, or it's specific rural organisations. So advocacy has become very effective over time, and that's because of the quality of the CEO, but also previous chairs. We've had wonderful chairs who have really felt very strongly, are very skilled, and who've put a lot of effort into the organisation, having a front, having someone who is prepared to take on board some of these difficult issues and prepared to advocate and to do so with courage sometimes when it's quite difficult to speak out. Partnerships with government, with bureaucracy, with consumers and with professionals, and we haven't changed the health outcomes yet. But, for example, we're developing and have worked very hard to get KPIs that are outcomes-based, that are not just input-based, to try and measure the difference. But just putting on the table, for example, that there's a $2 billion underspend is a very good start. So 5 things that have... sorry, we go back. 5 things that have helped. The benefit of organising a high-profile event. So we have a national conference biennially that is a really important event, gets a lot of national press, is very well done by the staff in the office so that they get very high-profile coverage. The other event that gets high-profile is the Council Fest, which happens every year and means all of us go to Canberra for that meeting. The need to develop and protect a brand and develop a culture. And that, again, goes back to the quality of the CEO and the people who've been in the organisation before I joined it. But there's a real culture, and I talked about this on Wednesday, but it's a very extraordinary culture that, for example, the chair gets piped by bagpipes into the annual general meeting, which is a very extraordinary thing for me to have happen. But it's part of the culture that we actually have a bagpiper there for our annual general meeting. So we have some very extraordinary, peculiar things that are very much the culture of the organisation. Very strange. So the quality of staff, it's really very obvious one, but ensuring the product is high quality. The other thing we do, and if anyone's interested, you can have a look at our webpage and see the quality and the calibre of the policy statements that we put out. We do policy statements a lot, and we employ people not necessarily full-time who are policy officers. So they'll do a policy, for example, on locums. They'll do a policy on fly-in, fly-out services, a policy on broadband, a policy on the national disability insurance. And those policies sit there, but they don't just sit there. They're given to government and they're acted on, and very often what comes back from government has embedded in it what we've done as the policy work. Now, this is Gordon. This is not me, but this is part of the culture. Gordon has a wonderful sense of humour, and he's done a great job with this. this is the recipe, this is the culture. And I added to this, it needs a chef. And for us, the chef, the consistent chef, has been our CEO, Gordon Gregory. And this is how he would describe, with his inimitable sense of humour, how we work. Now, I've got a couple of things, if I can have just a couple more minutes. Is that all right? I'm sorry. Is that all right? Okay. This is a caveat that we always say, because again, we can't speak on behalf of our member bodies, but we're very careful to make sure that they back us. I think if there are any lessons that have come, not just from what I've said up there, but, you know, 22% of your New Zealand people are providing a substantial part of your income. And I didn't understand that this morning until Malcolm said how reliant you are on agriculture and rural agriculture and the sort of stuff that's done, I guess, through wine, and I know sheep and I know dairying. But for your country to be wealthy, you require your rural people to be healthy. So you've got this lovely, positive, okay, this is what we're standing for. We're keeping the economy healthy because we're keeping the people who produce your economy healthy. So think about the positives. Think about how you sell your messages and the content of your messages follows. Okay, now for us to keep our population healthy, this component needs a particular part of your effort at the moment, or needs a particular policy, or we need to tweak something to ensure that you keep that. So the other thing is a strengths-based approach, and I know most of you know this because this is how you're taught to practice, but if you see your organisation not, oh gosh, we haven't got very much money, how are we going to manage to do it? Rubbish. Look at the experience you've got in the room. Look at the skills. Look at the talent that's got you here with no money, or virtually no money. So don't let that deter you. Absolutely work from strengths and not deficits, and take control. It's not, oh, how little have we got? How on earth are we going to make a difference? No, look at the experience you've got. You've got organisations and people who've been working to keep 22% of your country healthy for years. Look at the experience you've got. And look what you've got when you bring the farmers and the dairy women and the other people in together with you. The capacity for you to make a difference is absolutely, utterly massive, because all of a sudden you've stopped thinking outside my health professional head, and I've thought about myself as part of the rural community, and our capacity is bigger. So what now? Go to the minister. Tell him what you can offer. And I know it's a him, because I heard it's a him. I'm not being gendered here. You have a him. I don't know what the opposition person is. Could be a him, could be a her. But I would also go and talk to them. Say, this is what we can offer for you. Have a budget that says, okay, this is how we can help you to our fullest extent. And that budget gives you a proper organisation. It doesn't give you half an organisation. But you keep at the back of your mind, well, if we don't get it immediately, how we can manage what we're doing. But don't manage on a deficit, manage on a positive. Manage how you're going to do it. That's really what I want to say. I've just had such a good time. I've very much enjoyed being part of this. It's actually not embryonic, it's fetal, and now it's neonatal development. And I think National Rural Health Alliance has been really privileged to be part of the embryonic and fetal. And now I'm very proud to be part of the neonatal development. And I really look forward that we will be able to collaborate and share more in the future. So thank you.
Just to dive in and give a wee plug here for More information about RHANZ is in the far corner of the exhibition space, including membership applications. Thank you.
Thanks very much, Lesley, and I encourage you to take that political message along on Sunday morning to the breakfast, the workshop on 9 till 12, when we have got the Associate Deputy Minister, Cathy O'Malley of Health there from the Ministry.